Jeff Johnson, your thoughts about what you would do at the state level to try to make healthcare insurance more important?
And I think this is an area where we differ rather dramatically. I really believe that more government control of healthcare, whether you're looking at it at the state level through MNsure or at the federal level through the ACA or Obamacare, has not been good. And the promise was you'll keep your doctor and your premiums are going to go down. Premiums went through the roof in this state. They got worse after the ACA and MNsure, and deductibles are still some of the highest in the country, and that was not the case before. Minnesota actually did this better than any state in the country 15 and 20 and 30 years ago. We were a trailblazer as a state. We were the first to have a high-risk pool, the MCHA pool, that took care of everyone with pre-existing conditions. We did that in Minnesota before the federal government said we had to do it, because that was a value that Minnesotans had. And by the way, there's a commercial on television already saying Jeff Johnson will take away your health care if you have pre-existing conditions. Of course I won't. We have never done that in Minnesota, at least not in my lifetime, and I don't think any of us wants to do that. We need to take care of the most vulnerable people. But it's not working right now. And there are really two pieces of this. Number one, how do you take care of vulnerable people? And I think we should move back to our high-risk pool, because that actually took care of those with pre-existing conditions and did it in a much more efficient way than what is happening right now, much more cost-effective way. And it didn't throw the individual market into turmoil as we're seeing happen right now. And the other piece is for those who are paying for their own insurance, either in conjunction with their employer or through the individual market. And we need to start creating more competition for the insurance companies that are already out there, because there's very little right now. I believe we should create incentives for employers to self-insure. That creates competition for existing insurers. I think we should allow Minnesotans to buy across state lines. I don't think they'll ever figure that out at the federal level, but we can enter into compacts with states that surround us to open up that market and give people more options, especially in greater Minnesota. I think we should start rolling back state mandates. We have more than most states do. And I don't believe that as governor, I should be able to tell someone, if you think that a limited coverage policy is best for you, I know better, you can't do that. Let's give people more options and more choice. When you bring that competition into the marketplace, that increases quality and it brings down costs. We're heading in the opposite direction right now.
Tim Walz, your opponent said to bear will help bring health insurance costs down. What is your position?
What's it cost to set your arm at the Brainerd Hospital? Anybody here know? Or the Nisswa Hospital?